And you're good to go.
Okay. Okay. My name is Kylie Smith. I'm an osteopathic physician. I work in Georgia. Um, I just want to thank a couple people. So thank you, Dr. Clearfield, for letting me come and advocate for my patient. And I also want to thank my patient and his mom for allowing me to tell his story. Um, and I want to show you something before we start. I don't know if you guys can see this, but this is his mom's work, putting all of this together, keeping it together, organized. So fascinating. Anyway, and I want to thank my family for encouraging me to do this, and my work family. And so anyway, okay. So I know you guys are very busy, and I appreciate you guys being here because I need some collective minds. And on our next slide, I'm going to kind of go through what that means. So the objectives: to present this case in the most organized, succinct manner possible, to elicit discussion and brainstorming of etiologies, diagnostics, or therapeutics not yet attempted or performed yet overlooked, possibly, to gather any suggestions into a proposal for moving forward, and to experience camaraderie examining a difficult patient case. This is in honor of my son Blythe. He loves this movie, and you guys have all heard this quote: "If I have seen further than others, it is by standing upon the shoulders of giants." And I just want to tell you ahead of time that this group is my set of giants. Okay, so when I hear you guys speak, I like to kind of have a little snippet of what we're going to be talking about and then kind of go through it. So this is just a little snippet of what his current symptoms are right now. So generalized paresthesias, dizziness. So there's 3 types of dizziness. I know I'm not telling you guys anything you don't know, but my medical student is watching, and so I feel I need to kind of go through that. So 3 types of dizziness: for vertigo, spin, off balance, and oh my gosh, I'm going to pass out. So at some points he's kind of experienced all 3, but most of the time it's the off balance, feeling weird, and then the vertigo. Severe chest pain with dyspnea, pain from the neck to the pelvis, squeezing, and then he'll have a bloody stool. His mom reports he'll scream in pain while he's defecating. Nausea associated with headaches and dizziness. The vomit, he can have undigested pieces of food, even though he's on a soft diet, just for the pain. And he has generalized weakness, and he's using a wheelchair at present. He's needed that in the past, but then he would get better. And you'll kind of see that. So this is just a snippet, and just to give you an idea of what you're going to hear about. Okay, history of Pelvic illness. I'm going to read these just because on the transcript, sometimes when I go back and I haven't been here in person, it's really tough if you don't kind of read through it. So anyway, bear with me. So on 11/2/22 is when I first saw him. He complained of long-term diarrhea, described it as spinach green, orange, red, different times. Mild gradual weight loss of about 10 to 15 pounds despite eating a lot of calories. Not sleeping well, changes in vision, different colors with or without blurriness, and it would be one eye, both eyes, episodically, either one. Sometimes it could be associated with a headache, sometimes not. Fatigue, nocturnal dyspnea, likely orthopnea, which is lying flat and getting it. Itchy, dry patches over several areas of skin, always skin colored, never red, no pink. He paresthesias everywhere. And about 5 years before that, he had an episode of extreme fatigue associated with weight loss and severe constipation. He saw GI doctors, several other doctors. No diagnosis was given. I'm pretty sure that's when he had his first EGD and colonoscopy, and those were both negative. And you'll see that later. Just as a kind of background history. So the mother recalls patient having episodic fatigue around 13 years of age at first, along with occasional digestive issues, but she attributed it to being a teenager. He was at boarding school, so it wasn't significantly worse, whether he was home or there. And in March of 2022, he got a severe cold, nothing diagnosable. And while he was still recovering that, in April, his roommate body slammed into the ground, choked him until he was almost unconscious. And that's when a lot of his symptoms became worse. And just to clarify, because if I were listening to this, I'd be like, what the hell? Why would the roommate slam him down? They thought he was on drugs. So anyway, past medical history and diagnoses. So at first, like, these are going to be from other people. So episodic sciatica between 15 and 19 years of age, severe episodic right knee pain since 21 years of age, tinnitus that started after the slamming episode, the assault, which I just told you about, hemoglobin A1C 5.8, which we know is abnormal. That was in May of 2022. An abnormal bubble study with his echocardiogram in May of 22, and a follow-up CTA of the chest was negative. He was diagnosed with atypical cataract of his right eye in May of 22 at the optometrist. So there was like scattered opacities on the anterior lens capsule. That's on the right eye. The left eye, I think I might have listed it later, but there was a posterior lens cataract. So completely two different etiologies, and the optometrist kind of mentions about that. Cavernous hemangioma, tiny cystic areas versus biliary hematomas of the MRI on abdomen, June of 22. And an arachnoid cyst that was first thought to be a meningioma of his right temporal lobe is 1.7 centimeters on the MRI of the brain. An abnormal MRI of the L spine where there was bone marrow edema at the L4 pedicles, right side more than left side, and small zygapophyseal joint effusions at L2-3 through L5-S1. And that was in October of 22. Okay, these are things that after he was seen by me, these were added. So nocturnal orthopnea, unknown etiology, intermittent proteinuria of 2+, and then it would, be negative completely on other ones. Urinalysis, excuse me. Complex migraines, just because they couldn't find another etiology for some of these crazy headaches, colored vision, weird shaking, and all this stuff that would happen all together. So it just seemed like it might fit. Elevated fecal fat, cryptosporidiosis, and you'll see the labs later, but that was in January of 2023. He was diagnosed with COVID-19 in April of 2023 and had a worsening of his symptoms after that. And I put this in there and I put it in brackets because it may not be a diagnosis, but it's odd. So he went through airport security and his groin just lit up. And that was in May of 2023. And they looked at him and said, "Hey, dude, need to get that checked out." And so I just want to throw that out there. He had a low serum thiamine level after the original one. So his original thiamine was tested and it was 2022. It was completely normal. And you'll see that in the labs later. But then it was retested in August of 2023 and it was low. And I'll show you that. He also had episodes of mild hypokalemia. And I've listed a couple of those dates. He had MTHFR gene mutation testing and he was heterozygous. And you'll see that later too. Past surgical history, no real surgeries, but procedures-wise, he had colonoscopy. If you'll notice on the right-hand side, it starts with the 2018, and there was like a red streak. I don't have that copy of that report, but it was done for the severe constipation, like I had mentioned earlier. And then he had a colonoscopy in May of 2023 that was normal, and I have the reports for that. I mean, everything was completely normal. His EGD at the time of that one in May of 2023 was also normal, and his EGD was told to be normal in 2018. Medications currently that I'm aware of, THCA 3 times a day, and some liquid morphine that he recently had prescribed by me just because his pain was so severe and we didn't know what else to do. It just miserable. So he has no known drug allergies. Family history is pertinent for his father died in his 40s of cirrhosis attributed to alcoholism, and he himself was adopted, so we don't really have any of his extended family history. Mother is living. She's got fibromyalgia and benign colon polyps in the past. He had one older brother who died at the age of 21 from a self-inflicted gunshot wound. They think it had to do with how he changed after he was in Afghanistan during the military and came back with a changed personality. And they also, as far as medical history, the only thing they could come up with was some back pain after he had gotten in like a car accident. Maternal grandmother is deceased at 71 years old. She had acute leukemia. Before that, she had lung cancer with a partial resection and then radiation and chemotherapy prior. So not sure if that influenced the leukemia. and she had a previous diagnosis of IBS, irritable bowel syndrome. Maternal grandfather is deceased at 72 years old, and he had bladder cancer. So social history, I just want to have you understand kind of who he is, and then also give you a little bit of background as far as what you may be thinking, like, was he exposed to something? I just kept thinking, well, surely he's been, somewhere that he had some exposure. So we'll go through this. He's the second child of his mother. Pregnancy was fairly normal, except for it was severe nausea and dizziness, and she was on bed rest. He was originally a twin with 2 sacs in the first trimester, and then that twin vanished along with the sac. He was delivered by spontaneous vaginal delivery, had a healthy childhood, no significant illnesses. He grew up in Maryland until 10 years old. Then he moved to Georgia. And at 13, he transferred to boarding school in Pennsylvania. Then he finished high school in Georgia again. Then he moved to Colorado in 2015, started working on different farms over the next 1.5 years. Interestingly, he worked on a hops farm, and then he worked on a beet farm, and then he decided to go back to college. And so still in Colorado, he moved to Denver after he went to college for a little while, I think, and then he decided, I don't think he was having symptoms at the time. I think he's just like, you know what, I just want to be a musician. So in Denver, he was working and making good money doing that. And then during COVID, there weren't a lot of concerts going on. So he worked for UPS for a short time. And I put that on there because later on, you'll see like he was lifting 100-pound boxes and bags with no problem. He's heterosexual. He was living with his fiance in 2022 until he began showing more signs of his illness, and then she left. And specifically, she never had the symptoms. So I was thinking if it was contagious at the time that this has started, maybe she would have symptoms, but neither the roommate, even though he was on drugs and a little bit nutty acting, he didn't show signs similar to my patient either. And the fiance did not. He moved back to Georgia to stay with his mom because he couldn't work because of his illness. He began feeling much better, so he moved to Arizona. This is in 2023, I think, for a stint. And he was trying to attempt to finish his bachelor's degree in music. He attended a music festival in California. I think that was in April of 2023, and contracted COVID, and then he started getting worse again. He moved back to Georgia to be with his mom and continues to decline. The family plans to sell their home and move to Colorado to have access to more robust medical services. And they're leaving Tuesday, I think. And as far as like other things, nicotine, he had smoked in 2011, quit in 2018. Ethanol, he used to have like 1 to 6 beers a week, very occasional, but then he just quit completely in January of this year. He denies any illicits, cocaine, heroin, all the things that you can think of, meth. I put the star with cannabis because, in certain states it's an illicit. So anyway, I thought you guys would enjoy that. But he does use cannabis, and it does help him. He previously enjoyed skateboarding a lot, and was really good at it, and he played guitar, and he can't do that anymore. He's just too tired, and it hurts his arms. He's got too many paresthesias, and he used to perform 18 pull-ups a day and 72 push-ups. And now he can't do any of it. So his review symptoms, now, actually it should be systems. I apologize. I want to fix that, but I'm not going to. It's more like, what does he not have? And I apologize for the long list, but I really think sometimes you guys will be like, you'll catch one little thing and like be like, oh, he could have XYZ. And so I really don't want to miss anything that's a positive symptom. So I didn't list any like negative, like he doesn't have this or this or this. It's just the positives. So paresthesias, he describes as a deep tingling throughout his body. Dysesthesias, touching and hurting. Dry, flaky patches over scattered areas of his body episodically. So it's not there all the time. It's just sometimes, and it doesn't seem to be correlated with, the stomach issues or the neurologic issues. It's just random. Itching, especially over the back shoulders here, and then his posterior calves and left forearm. Urethral burning episodically, malodorous black tarry stools that can also be green or yellow, severe abdominal pain, like I described. He'll like cry out and like be crying in pain when he's having a bowel movement. Intermittent difficulty concentrating or processing thoughts, ringing in both ears, mostly when he lays down. And that's whether day or night. Orthopnea that can sometimes be paroxysmal and nocturnal. So at first, when I saw him, he would get shorter breath anytime he laid down. But then it was like it changed, and it wasn't like that. And only at nighttime, he would like wake up and just be like, whoa, I can't breathe. And it wasn't like sleep apnea. It was like it would stay even though he was awake. And with sleep apnea, of course, I mean, you know that it would just stop. Like you would be able to breathe then, but it would stay for a while. Unintentional weight loss, like we discussed, I think it was about 10 to 15 pounds total. Excessive thirst, extreme tooth sensitivity, gums even, he's described, a large varicocele, and he's had that checked out by the urologist. Devices. So he noticed that, you know, at first he was okay to go get MRIs to investigate these things, and you'll see how many he had. But now he won't do it. He refuses because he said it takes him days to feel right. He feels awful. And his mom mentioned in the symptom list that he's having now that even electronic devices, like being near the phones and things like that, is just, it makes him feel horrible. He has abnormal involuntary muscle movements, sometimes associated with electric shock sensations, and it's very repetitive. So sometimes he's described like 5 to 300 in a day. And in all the neurology consult notes, they mention it. There's a couple of hospital stays where they mention it too. And he had a video EEG, so you'll see that later, but it's kind of all described. Constant dizziness, like we talked about, headaches, and they're, you know, bitemporal and retroorbital. Dysgeusia, I put that for my med student because he needs to know what that is. But first, a soapy taste all day. So like when he had his list from 2022, it was the soapy taste. But now in 2023, it's listed as, you know, metallic taste. He's complaining of. He's having some mood swings. I spoke with the mom and I asked her, I was like, do you think like he's changing? And she's like, no, it just seems like it's like when the pain is the worst, he's, you know, super irritable, you know, expectedly so. And he'll cry a lot, and even cry when something good happens, because he's just like, oh, you know, like something good happened today. So it's just not like him from previous. Difficulty speaking at times. So again, this is all from my med student, but dysarthria. So like I garble speech or whatever. And then sometimes aphonia. So like I can't actually make the noise. Extreme weakness. He's using a wheelchair now, and he describes it as his whole body feels like it's drenched in lead. It's a pretty good description. And some generalized hair loss. There's no like patches of alopecia or anything like that. Episodic partial paralysis, and sometimes it's been like he's described it in his face, arm, leg, but it's never like all one side or anything like that I can recall. And then sometimes he'll have severe cramping in his wrists and hands, whether he's doing something or not. Okay, so I wanted to kind of make a list of these are the consults he's had, whether, you know, you consider the people that I've listed consults or not. I just want to have kind of a record. So he saw the neurologist in Denver in October 22. Then he saw Emory Neurology in Georgia in November of 2022. Emory GI in March of 2023. Hematology Oncology in Arizona, and that was in June of 2023. Then he saw neurology in Arizona, and I don't have the dates, and I apologize. Then he saw GI, I believe in Arizona as well, 2023. Chiropractor. So there was one that did functional medicine, and then there was one that did actual adjustments. And then he saw, we don't know what kind of a doctor he was, but it was basically he had a hyperbaric oxygen chamber that could be used, and he went there, and I'll show you the treatments later. He went to a reflexologist, craniosacral therapist, and a neuromuscular massage therapist. Okay, so these, I kind of tried to compile out of all the exams that I had done, because to be frank, like some of the consult notes were lacking. I mean, just kind of like, well, it's just like click a button and, but the summary said they were physical exam findings were all normal. So whatever. But he had occasional right lower quadrant and mid right abdominal tenderness. But sometimes it wouldn't be there. No overt rashes, his fingernails and toenails, no changes of concern, no jaundice. He would wear glasses on occasion. His vocabulary is profound compared to his peers. And I put that because sometimes I put that in my notes because I want to remember that this person is a very schooled or intelligent or whatever the word I need to use, but so that I can understand, like, okay, this is not someone that has not been around the block and had life experiences, usually. He's thin but not cachectic. Muscles are well developed. No overt atrophy. Again, like he was doing all the push-ups and everything. I mean, he was very well developed. No abnormal heart or lung sounds and no rashes visible while at his visits. Now, he did, or his mom, I think, sent some photos of some sores that were on his legs. And I don't have those with me right now. So I'm so sorry. I can't describe those, but I'll just leave that. So I tried to figure out the best way to show you the labs, because if I were listening to this, I'd be like, come on, bring it on. But so I apologize for the busyness of these slides. I kind of want you to, usually people will zero in on certain things that they want to know about. So go ahead and read the slide, but I'm going to go through it and just kind of run through. So before he ever had these symptoms that I know of, he just went to an urgent care and they did the STI screening. It was all negative. And then in May 22, he started having these symptoms. So they tested him for rheumatoid, Lyme, and then autoimmune screening. And the CRP was negative. And then about a week later, his iron, his ferritin was 91. And then I put on there in another month, it's going to be down to 64, but it doesn't trend downward. So I just want to give that clarification. Magnesium was normal at 2.0, SED rate 2, H. pylori breath test negative, ANA again a week later negative, which is, Vitamin D was 34.4, and then about 5 months later it'll be 29.5. Iron was actually high at the time, so it was 189, and then in a month it'll be down to 87. Excuse me. And you can see the iron stats and stuff. Total cholesterol was 155, HDL 67, triglycerides 47, LDL 78, urinalysis was negative, potassium was 4.6, endomysial IgA was negative, IgA quantitative serum was 118, which is normal. If I didn't mark L or H, it's normal. And if I thought maybe you weren't or we weren't familiar with the normals, I'll have that in brackets. A1C was 5.8, like I mentioned earlier. Testosterone, thank God that was on there, because all I could think was Dr. Clearfield's going to kill me. I didn't do a lot of hormone testing. But anyway, so 808, free testosterone was 12.3. B12 was 277. So we would think that was low. They don't mark it as low, so I didn't mark it as low, but I fully realize that it is. Folate 14.2, TSH 0.95, TIBC 300, CO2 was a little bit low at 19, and it will be low in the future too. You'll see creatinine, was 1.03, and tissue transglutaminase IgA was less than 2. So in June, so about a month later, they tested him, because I think it was like a lot of the GI symptoms. They tested him for hepatitis A, B, and C. They didn't really test for hepatitis A or B active infection. They actually only tested for whether he was immune. I don't know. But the albumin was a little bit elevated again, 5.3. And then I just put for reference, it was 5.0 last month. CRP less than 1. PSA was 1.1. C-peptide 1.5. Amylase 63. CEA, which is the carcinoid embryonic antigen or whatever, 1.4. RPR is non-reactive. Vitamin B1. And that's again, like, so this, he'll be low in that later, but it was 154.8. And you can see the normals there. insulin 3.4, lipase 26, HIV non-reactive, vitamin B6 31.6, testosterone again they tested so 740, free testosterone 10.4, and then about 3 months later, CRP again 0.16, SPEP was unremarkable, but his albumin is still high 4.6. His acetylcholine receptor binding antibodies and blocking antibodies were negative. His methylmalonic acid is 111, aldolase 3.7, Lyme IgMs. There was a bunch of them. They were all negative. And then there was a bunch of IgGs. If you've seen those before, there was only one IgG positive. It was the P41, which, is like past exposure. Anyway. So October 26, 22, some of these, full disclosure, I did not list all the labs. I'm just listing ones that I think might be applicable to what we're dealing with. So apologize. So creatine kinase is 184, and then the type was 100% the MM, which is the muscle kind. I put the asterisks here in November because that's when I first saw him. So it doesn't mean that all the ones after that are mine that I ordered, but I just want you to understand, like, all the stuff we've already looked through is all up until when I saw him. Okay, so I did a venous blood gas because of his low CO2 level to kind of see if he was like dealing with metabolic acidosis, and his pH was good of 7.36, and his bicarb was actually elevated at that point, so 31.6, and his urine showed the 2+ protein, specific gravity 1.025. And then he went to the ER in December. I think that was when his first potassium was low, 3.3, creatinine 1.04, TSH 0.467, CRP less than 3. RBCs, I'm pretty sure that might have been the first one that was low. His hemoglobin was normal, but his red blood cells were a little bit low. And then his RDW, and I know you guys love that too, but Dr. Patel probably really likes it. But that to me shows like he wasn't bleeding, or he wasn't like trying to make up for it. At least why are his cells not like half big, half small with the RDW like that? So interesting. And his eosinophils at the time were low, and you'll see why I thought that was important. And then January 2023, his stool occult blood, that was something I ordered too. That was negative. His C. diff was negative. UA showed no protein then, because before it showed 2+, and he had 2+ ketones. Felt likely because he had fasted. I don't know. And then, so interestingly enough, so I put the little asterisks. I hadn't ordered an ovum parasites because a lot of times they're negative, even, when you have problems. But they called, so the lab called our clinic and said, there's something moving in the patient's stool sample. Can we get an ovum parasite? But, okay, so that's weird. So we're like, oh, heck yeah. But again, so the OMP was negative when they did it. So that was disappointing. But then in January, he was still having problems. So we did another stool sample, and that's when chymotrypsin was low. So you see 1.0, and then the normals are 2.3 to 51.4. And his pancreatic elastase, which I was trying to see, like, okay, well, is that, pancreatic dysfunction or what? But it was normal. And then a couple of days later, we got the fecal lipids, and it says 18 grams in 24 hours. But when I talked to the patient, he hadn't actually collected for 24 hours. Although even if he still didn't collect in 24 hours, it still would be high, right? Because 18 grams in 24 hours, that's still high. I don't know. But I just want to disclose that fair. Fecal fat qualitative was normal. And then the calprotectin was normal. That's for like inflammatory bowel. And then we ordered a pathogen panel, the PCR test, and then that's when the cryptosporidium was positive and detected. And so I don't know if that would have explained the movement in the stool or not. And then we did it again after we treated him to make sure it was gone, and it was negative. And then so I wanted to retest the chymotrypsin and the lipids because I didn't know, well, did he have cryptosporidiosis? And then that's what caused those abnormalities. So you can see the chymotrypsin went to basically normal, and then the fecal fats were still elevated. Okay. May of 2023, you can see potassium is normal, 4.6, creatinine 1.04, albumin slightly high, 5.4, ALT was 16, normal. And then I got these. I really wanted to know if some of these things could be like allergic type things. So I wanted the IgE, and it's normal. But then I was like, well, we'll add the other ones because he's got this weird crypto, and I don't know if he's got some immunoglobulin deficiency or something. But they were all normal, as you can see. A month later, I'm pretty sure this is out in Arizona, if I remember. Anyway, his hemoglobin was quite low, 12.7, and his red blood cells were 3.97. His RDW still normal though, 12%. And then his CRP was less than 3, homocysteine 8.3, methylmalonic acid 111. I'm pretty sure this was ordered by the functional chiropractor, maybe. Creatinine 0.92, albumin 4.6, microsomal thyroid peroxidase antibody 34.9, mitochondrial antibody, Smith antibodies, scleroderma antibody, smooth muscle antibody, SSA and SSB antibodies were negative, centromere antibody negative, JO1 antibody, histone antibodies all negative. And they tested him for West Nile virus, IgM and IgG, and it was negative. ANA was negative, vitamin B12, 474, which is better than when he originally got it. So that's good. Folate 11.6, double-stranded DNA was negative, and this anti-CCP antibodies, the IgG type, was negative. Okay, so then he went to a hematologist oncologist and had the paraneoplastic lab. It's like a panel. And if you guys want to see that, you can see it, but it was all negative. So no worries. Then a month later, I don't remember who ordered those, but you can see his sodium is 135, so a little bit low. Potassium again is low, 3.2. His CO2 again is low, 20. His creatinine's kind of, his baseline kind of like 0.9 to 1.05 or whatever, so it's a little higher than usual, 1.26. Total protein is elevated as well, 8.3, albumin 4.7. His white cell count, to my knowledge, that's the only time I've ever seen it high on labs. So 10.85, the neutrophils were high and his monocytes were high. So, and his hemoglobin was normal at 14.5. And then, let's see, 720, that's 731. So maybe a week or two later. Okay, so then remember we talked about the B1 was normal the first time. So this is about I guess maybe a year later. It's low. I think it was different types though. This reference range is way different. This one's off of serum, and the other one was whole blood. So some of you out there that know a little bit more about lab stuff would know more than me. But I noticed that the reference range was a lot different, but still low. And red blood cells 4.33 is listed on this lab as normal, even though it's actually lower than other ones of the labs that said it was low. So Dr. Teitelbaum will be so happy right now, just because I know he hates labs. Creatinine 1.00, as SPET was normal. A1C, before it was 5.8, it's 5.3 now, so it's not like continuing to get worse. Anti-gliadin antibody was negative, lipase 27, vitamin B12 540, ferritin 112, rheumatoid factor less than 10. They did all those. I'm not going to read them off, but all those autoimmune panel, again, it was all negative. Then they added neurofilament light chain, and that was normal. The path review of his blood smear was completely normal. And I think that's pertinent too, because some of the things that I read, like if you had schistocytes or, anything like that was showing any kind of sign of red cell damage or something, that would be good to know. So his tissue transglutaminase IgA antibody was again negative, CRP again negative, cholesterol is there, PT 11.8, just in case you guys wanted to know what his bleeding times and stuff. Iron 122, and then the anti-CCP antibody again. Okay, these are a little bit different labs, and okay. I had not seen these until I started making this presentation. This little set right here, the 802-2023. Okay, so those are new ones for me today. So fibrinogen 215, D-dimer less than 215, ferritin 121, copper 59, low. You can see the little reference range there. Creatinine 0.95, transferrin 238, free kappa and lambda light chains, no elevation, and zinc 62, which is on the lower end of normal, but doesn't say low. And then I think it must have been the hematologist oncologist. That's who ordered those August 2nd labs, is the hematologist oncologist they saw. And then in Arizona. And then August 15th, I think that must have been as well, but it's Lynch syndrome panel. And it was a variant of uncertain significance. So a day later, the red cells were, still low again, and then hemoglobin normal, potassium low again, 3.4, anion gap, it says was high, 18. So albumin 4.9, MCV. I just wanted to kind of show like it's not like changing. It's not going, the average cell volume was not going up, going down. The RDW is 12.6. Chloride was a little high at 108, creatinine 1.21, TSH 1.0, CO2, as we know, 18, low. And then his EGFR was listed as low because of his creatinine being a little bit high. Okay, these are my labs. So he came back and told me, he's not doing well still. And I, oh my gosh. So I know you guys have patients like this, so I know you know what I'm talking about, but it was so sad. So I was just trying to do I don't know. Anyway, so urine organic acids, normal pattern, acetylcarnitine profile, plasma, normal pattern, amino acid profile, urine pattern not suggestive of specific amino acidopathy. Pyruvic acid in the blood was 0.4, which is normal. Creatinine kinase, again, normal. We had done that, or someone else had done that before. Lipase 35, vitamin D 50.1. His testosterone, thank you, God. I did test that, Dr. Clearfield. So, okay, 377, which I put an asterisk because I realize even though they say it's normal, that is completely abnormal for a person his age or anyone else. So I learned a lot from you, Dr. Clearfield. Don't give up on me. DHEAS 279, which on their scale is normal as well. LDH 159, normal isoenzymes, and creatinine is 1.00, potassium 3.8. Okay, and then we ordered, because he wasn't, that didn't really show anything, so we did heavy metal testing. And at first I didn't know that there was cadmium in another one. So you can see so on December 4th, I did the arsenic, lead, and mercury one, and the creatinine was low. And I didn't know if that's because he's losing muscle mass or what. And then so we did it again. His creatinine was okay that time. And then again, negative for everything plus cadmium that time. And then urinalysis was negative, no protein, no ketones, no blood. And we wanted a urine D-lactate for lactic acid or whatever, but the lab didn't send a frozen sample, so we didn't get that one. I have it reordered, but it's not done. Okay, so now we're going to move on. So that was all labs, and I apologize. Thank you so much for your patience. Okay, so investigation. So this is anything but labs. So I did oldest to newest. I know normally we do newest to oldest, but I think, at least for my mind, I want to kind of see what they did before. Okay, so chest x-ray in April of 2022 was negative. The eye exam with the optometrist, we talked about the cataracts were seen. Echo was done, and then there was a late arrival of the agitated saline bubble, and they mentioned mild pulmonary regurgitation. So then the cardiologist did some like a treadmill stress test. It was normal on ECG and blood pressure and all that stuff, but the patient said he felt awful the whole time. He was super off balance, dizzy, vertiginous, all the jazz. 7-day Holter monitor showed no abnormalities. It said like a couple of PVCs, kind of like the normal stuff. No runs of, long tachycardia or anything. CT of the chest was done for follow-up on the late arrival of the agitated saline bubble. And so that was negative. It did not show any kind of venous malformations, arterial venous malformations, or any kind of fibrosis, anything in his chest. No blood clots, nothing. CT abdomen with and without contrast, June 7th of 2022, showed 1.3 centimeter and 7 millimeter likely hepatic angiomas, otherwise unremarkable. And so as follow-up to that, they did an MRI of the abdomen with and without contrast, and T2 hyperintense nodules consistent with hemangiomas were seen, and a few tiny less than 4 millimeter scattered cysts versus biliary hamartomas, which hamartomas aren't super Anyway, they said incidental. So I thought, but otherwise negative. And specifically the pancreas said within normal limits. MRI of the brain without contrast was done on June 17th, 2022, 1.7 centimeter anterior right temporal meningioma. And then just for ease of looking at it, the little asterisk is just like the second MRI. So MRI brain with and without in July showed fluid signal anterior to the right temporal lobe, demonstrates no abnormal enhancement, most consistent with arachnoid cyst rather than meningioma. And the double asterisk is the third MRI. So MRI with and without about a year later showed no pathologic enhancement and no mass lesions identified. So I did look up whether arachnoid cysts could resolve on their own. And apparently there's a lot of cases where they do, but they think that it's because it ruptures and then just kind of reabsorbs into the CSF. So I did look that up. So maybe it really isn't there. I don't have the disc for myself. I might in this binder, but I did not look at it, and I apologize if you are disappointed. MRI C-spine without contrast, August of 2022, shows straightening of typical lordosis can be seen with injury. Disc herniations at C5-6, C6-7 with broad-based disc protrusion indenting the fecal sac. Posterior annular fissure, C5-6. And then second MRI of the C-spine with and without contrast was done a year later and shows a small focal increase T1 and T2 signal in the left C4 facet, non-specific but likely hemangioma, otherwise negative. So a little bit of differences there. I didn't know, like I was trying to think, well, infectious things maybe, like could it, they said non-specific but likely hemangioma. They didn't say anything about that C4 facet thing. Okay, MRI L-spine without contrast in October of 2022 showed bone marrow edema in the pedicles of L4 more pronounced on the right than the left, consistent with bony stress reaction. Bilateral pars defects at L5-S1, moderate right foraminal narrowing at L5-S1. And then, so I quoted what was in the impression, and we all know that there's other stuff in the body of the paragraph. So again, for my medical student, you go up into the body of the paragraph, or of the report, excuse me. And all of this was mentioned, not in the summary. So it's really important to go back. Anyway, small zygopophyseal joint effusions at L2-3 through L5-S1, most pronounced at L5-S1. And then he had nerve conduction velocity with electromyogram studies done first in Denver, Colorado in October 22. It was normal. Again, in July of 23 in Arizona, normal. He had a continuous video EEG at a hospital stay, and that was in May of 2023. In the body of the text, I just kind of put it on there. So it says multiple clinical events of brief jerking of the torso and head with stiffening of his body without ictal EEG correlate, normal waking and sleeping background activity, frequent prolonged episodes of eyelid flutter artifact, no elliptiform activity. There's a spirometry mentioned, and I don't have another parentheses on that, and I apologize. Okay, but it says, one of the things listed was FEV1 as far as the predicted value. It was only 81.7% of it. That's really all that's listed on there that I could interpret. Then, interestingly, he had a lumbar puncture under fluoroscopy in August of 2023. The opening pressure is 7 centimeters, which is normal. I had to look that up too. 4 milliliters of CSF was obtained. And in the procedure report, it says patient began complaining of leg shaking, back pain, and leg numbness. Report states patient experienced moderate amount of leg shaking and pseudo-seizure activity, which was treated post-procedure with 2 milligrams of IV Ativan. The report, I know you can't see that very well, but I wanted you to, I guess maybe I tried to justify like I wasn't lying. I don't know. But I wanted you to be able to see the CSF because it was interesting that they say they actually tested the third tube, which is good. So the nucleated cell count was 9. The RBC count was 1,280. CSF polys, 25%. Lymphs, 46%. monocytes and macrophages 28%, and eosinophils 1%. How in the world do you get an eosinophil at all in your CSF? So that was interesting. But there was nothing said about it. And when he went back to the neurologist, they said everything was normal. They had like no oligoclonal bands and stuff, but that was really all they were concerned about was, well, you don't have MS. Okay, investigations continued. So MRI T-spine without contrast is August 2023. Showed a 5 millimeter T2 hyperintensity and T2 body, most likely an atypical venous malformation, otherwise completely negative. Echocardiogram, which is the second one he's had. The first one was the bubble study one. 2023, so ejection fraction 60%, right ventricular systolic pressure 29 millimeters of mercury, mild tricuspid and pulmonic regurgitation. His IVC was dilated, but he had greater than 50% collapse with respiration, which is normal. And interestingly enough, I had to look that up. So IVCs that are dilated, and you probably know that, but if you have that kind of collapse, it's usually with very well-trained athletes. If you have a dilated IVC that does not collapse, bad juju. Anyway, just wanted you to know. CT enterography was completely normal. I don't have that. I have not been able to look at that, and the mom has not been able to look at that. It was done at an outpatient radiology center rather than a hospital, so it's been very difficult to get the report. And he wanted an x-ray of his spine because he was seeing one of the chiropractors, and they wanted to see if he had any curvatures. So we ordered that, and there was no measurable scoliosis. So the therapy is already attempted, because I want you in your mind, you're like, well, why didn't they do this? Okay, well, I mean, we tried some stuff, and maybe I was a little nutty, but there's no judgment in this room. I can feel it. So when he saw neurology, like the first couple of times, I think, so that's when they tried him on duloxetine, which is Cymbalta, just for my med student. Okay. Gabapentin, which is Neurontin, pregabalin, which is Lyrica. I don't think he ever took the pregabalin, because I think the first two he had, he felt so weird that he was like, I don't want to take this. I don't want to feel weird. But I think he did try the methocarbamol, which is Robaxin, and it might have given some mild relief, but it wasn't enough for him to keep taking it. I think he tried morphine one time during that whole thing, and he said he didn't feel like he reacted well, so he didn't want to ever take that again. Cannabis throughout this time was very helpful for his pain, but he wasn't using it like routinely. And then because of all his, gut symptoms, we tried pancreatic enzymes in November of 2022. That's when he saw me. And they actually made his abdominal pain way worse. I'd use the vegan kind because I didn't want him to have any reaction to like porcine, antibodies or anything like that. So I think he tried them again a couple times, and every time it made him way worse. It would help the bloating, but the pain would get way worse. That's what he said. We first tried, because he came to me and I was like, well, right? So I was like, well, maybe he's got some immune weird dysfunction, or he's got Crohn's. Actually, I was thinking in my mind, well, maybe he's got Crohn's, because this is before his second CT and EGD. So we tried him on lotus naltrexone and methylene blue. Thank you, Dr. Alasa, because I think that was what was going on around that time. And melatonin, just for the anti-inflammatory stuff. I think that was FLCCC, like they were going through like the benefits of melatonin and anti-inflammatory stuff. And I was like, well, you're not sleeping, let's try it. Anyway. Then nitazoxanide was when he had the cryptosporidiosis, of course. We did the 500 milligrams twice a day for 3 days, and that was in January of 2023. He had really bad nightmares on that, but, we thought, oh, well, maybe he'll feel better, or the diarrhea will get better. Nope. Didn't feel better. Diarrhea didn't get better. Nothing. So disappointing. But so then I think empirically, I was like, we know the first thiamine test was normal, but it was blood. And so I read articles where the CSF, you can't really test the CSF thiamine, and sometimes it can be low. So I was like, well, let's just empirically give you an injection of thiamine. So we did that in February of 2023, but it didn't do anything. Didn't help him at all. We retried low-dose naltrexone and gabapentin again because I was like, well, you don't have crypto now. And, like a lot's changed, let's try it again. Didn't help again. And I think it gave him like flu-like illness. He just did not feel good. Gabapentin just didn't really help his pain. I don't think he had a bad reaction to it. So then he saw the functional med doctor and they put him on CoQ10 and alpha-lipoic acid. And neither one of those helped. He went to the hyperbaric chamber place and they did 5 days a week for an hour each session. And he kept going. And then by mid-September, he was a lot better and he could walk. But then he kept going and it just all kept coming back for no apparent reason. So then when he came back and he was back in Georgia, he had the lab that actually showed the thiamine in his blood was low. So I was like, well, let's at least try it again. And he had already had all those dysesthesias. And I sent them, I think, to Mallory. And they get B complex injection, and it didn't help. It didn't help again. He went to the reflexologist. He got neuromuscular massage, did the chiropractic care like we mentioned. And then I have a note in my notes about that. The mom kept saying, he really seems like he does better with like herb stuff, like essential oils and stuff like, and the THCA. And she got him the low THC oil card for Georgia. That's all we can get here. But yeah, rather than like prescription meds, he does better with that. Okay, so here's the assessment. I don't want to go any farther because I want to kind of see like what you guys are thinking. But a 27-year-old Caucasian male, he's about 130 pounds. When I first saw him, he was 134, just to kind of give you an idea. He's got multiple neuromuscular symptoms, severe GI symptoms, and his status is declining. And so I just wanted to see, I think, yeah. So what you guys think I should do at this point? Oh, I think there might be one thing. Oh, his mom feel like he could have a mitochondrial disorder, and they're going to Colorado and they're trying to see a geneticist for testing. I
don't know. This is Dr. Patel. Anybody has done the home environmental history and the history of his exposures?
Well,
I don't see it.
What was the last part?
I said I don't see that anywhere that you mentioned that.
Oh, okay. So his environmental exposures, I mentioned about like that he had worked on the farms and stuff like that.
Yeah.
And that's about all I could ask. I asked if he had been exposed to any kind of chemicals or worked in a lab or had pesticides, blah blah blah. I don't know of any. They don't know of any.
How long did he work on the farm, and what did he do on the farm?
You know what? I actually don't know. He worked for a year and a half on both those farms, the hops farm and the beet farm. His mom might be able to type in.
Was he in a good health? He worked on these farms. Was he in a good health then?
Mm-hmm. Yes.
Okay.
Like, I mean, he still had the compared to now, mild GI symptoms. Okay, so he still had that and episodes, like just episodes of fatigue, but no paresthesias, none of all the stuff, no the headaches, not the weird stuff.
Do they live in Georgia?
So they had lived in Maryland when he was growing up. Then they moved to Georgia. Then he went back to boarding school in Pennsylvania. And then he went back to Georgia. Then he went to Colorado, stayed out there for several years. Then he went back to Georgia to be with his mom because he was declining. Then he went back to the west, but he went to Arizona.
Okay,
and then he came back.
All of these are suggestive of that whether they are before he went on the farms, okay, right?
Mm-hmm.
that there is a possibility, because most of the states which are hot, humid, they do the spray inside their house for the bugs. So
Okay.
for the control, and the patient's whole picture fits into the acetylcholine, I mean organophosphate poisoning. Whether it sounds like it is the acute on chronic exposure, and every symptom fits that. You don't look only at the sludge, which is very acute poisoning, which is the like salivation, lacrimation, urination, defecation. But this patient, the neuromuscular problem are weakness, fasciculation, tremors, then there was some medicine was given. Then he had uh, the seizure-like activity, pseudo seizure-like activity, and then negative EMG, positive EMG, or most of the time it was negative nerve
Negative.
conduction study. Yeah, that is very common. Then his brain was, because it is related to the neurotransmitter, any destruction of the acetylcholinesterase and accumulation of acetylcholine. So he had all the symptoms of excessive, including the headache and dizziness and nausea. And you did not describe any vomiting, but you describe abdominal pain and cramps and intermittent diarrhea kind of symptoms. And so I mean, the whole spectrum of the symptoms seems like, and let's say you go back and you do the patient's red blood cell acetylcholinesterase level, and it may give you the positive answer, it may not give you the positive answer. But and another thing, that nothing helped except hyperbaric oxygen, and hyperbaric
Right.
oxygen does help because it improves the side effects of that, and it improves the oxygenation and improves uh, the some of the side effects, and the mitochondrial function and etc. But it is not a mitochondrial disease. So if you do the mitochondria, and that's the reason that somebody gave him the CoQ10 and whatever else was given, and patient did not notice any improvement. They gave patients methylene blue. They gave the patient XYZ. I don't recall everything what you mentioned, but
Yeah.
I remembered that everything was given and patient had minimal to no improvement. And patient had Cymbalta, patient had Neurontin, patient didn't try Lyrica because patient knows better that it just didn't help, and he was feeling worse on it because after all this is the neurotransmitter game. So
So can I can I ask
I
you?
will keep
So
my head out, and that's what I think it is.
I just want to make sure Dr. Patel, thank you so much. I love listening to your lectures, by the way. But the red blood cell acetylcholinesterase level, that's what I order.
Yeah.
Okay.
And
Perfect.
it may be normal, but if it is abnormal, then it gives you
Give you
because
something.
right,
Okay.
it gives you the guidance. But everything, like they when they live in the dorms, they spray there. In
Mhm.
the dorms, they spray for the bugs because this generation is like bugs. They jump when they see the bugs. So
They're phobic. They're phobic. Yeah.
yeah, yeah. So you got to remember that, and even the only thing I did not see, that this kid did not have insomnia.
He
Nowhere that symptom was described.
yeah, I just put difficulty sleeping because it's not
Okay.
I don't know.
So
It's not
which is common with the bug spray. Okay, bug spray,
okay.
and particularly he worked in the farm, so the uh, uh, farm usually they do spray, and it just depends when you are there and when they spray. So when they spray and you are not there, but then you go and walk there, then you are exposed.
Mm-hmm. No, I appreciate it so much.
Okay, because when you have a neuromuscular disorder and when you have a GI problem, and there were completely autoimmune panel was completely negative, which is very usual. They have, I mean, every test they have done, only very few tests are positive. So that is another indication that, and urine organic acid is not going to show you anything. So you may do a multiple other toxin exposure. You may find some guidance from there. But unfortunately, in chronic, and the same thing happened to the Afghanistan, our
Soldiers.
yeah, our soldiers, Afghanistan soldiers, it happened the same thing, that they were sick and they were not being, nobody thought of that poisoning. And I am still currently seeing a patient who is a, his mind works perfectly, but his body doesn't. And he has a phrenic nerve palsy. He has a, I mean, I, he's been worked up so much, but he was not getting better. And as soon as I started working on him, and he has also parts, he has a PTSD. So I mean, this person did not go to the war, but soldiers who went there, or the workers, because they went as soldiers, they went as a technician, they went as and my patient went only to supervise them. So he was
Right.
in and out, and still he ended up getting I mean, he's wheelchair bound, and he's a young strong man. And so I think what I'm trying to say is, when you see all the tests negative, and any patient you see with the chronic illness, always do the internal environment, the house they live in, and particularly ask for the spray in a Georgia. Most of my friends which are there, they are getting every 1 month or 2 months the spray, either inside their house or outside, just around the periphery of their house. If the periphery house they treat and the insects don't come, you think that air and things are not coming inside the house. It does.
Right. Now,
Okay, and it depends upon the individual susceptibility. So there may be 10 people around him doesn't have anything happen to them, and this is the only patient who has it, because it is individual susceptibility. His nutrient like B1 or B12, and we have to know that how it get detoxified. So that and vitamin D, those three things were low. And we know that B1 you can get the neurological symptoms. And then
mm-hmm.
B12 you can get neurological symptoms. But
Mm-hmm.
but by improving them, you did not notice much improvement in that patient.
No, none.
Yeah, and anytime when there is a problem with these I mean, some people would have worked this patient up for ALS, but he was
Right.
walking. He didn't have problem in swallowing, so they would not do. But anytime there is a problem with this kind of tremors or fasciculation, and it's many times it starts with fasciculation, and then it goes in tremors. Tremors is not the first symptoms, and nobody described the pupillary reflex. Pupillary reflex, if you see it, it is more myotic. Pupils are more myotic, and unfortunately we don't have too many centers, those who are doing the autonomic testing on the eye. So they do have a problem either with the sympathetic effect or parasympathetic effect. So or they may have a completely opposite of it. Another thing you can do is heart rate variability test, and you may see the you may see that there is a problem with the heart rate variability and postural hypotension, postural tachycardia. Because this patient
Okay.
did have intermittent tachycardia, I thought, if I remember it correctly.
He had intermittent. Did you say intermittent tachycardia?
Yeah,
I don't think so. He did the Holter monitor is all I remember. And
yeah, that was, he didn't have abnormal rhythm. But in
yeah,
a
he did
general, their heart rate would be higher.
right. But
With the
he
posture, change with the posture, okay? So you have to lay down the patient and then take the pulse, and then you have to do the pulse in the upright position, blood pressure in both
yeah, like
positions. And
postural changes. Yes, I hear
yeah,
what you're saying.
yeah, exactly. The parts, what we call. And then he said he had a constricting sensation in his
Yes.
extremity. That is a very typical. That's a very typical of uh in these patients.
But so the best test though is the RBC acetylcholinesterase level.
That is the test you can get,
Okay.
and if it is normal, that does not rule out. Okay, I just want you to
Okay.
tell that if it is abnormal, it helps. Just like Lyme test, if it is
Right.
abnormal, it helps. But if it is normal, it depends upon your clinical acumen and clinical expertise.
Right. I agree. Okay. Thank you so much.
You're welcome.
Okay, so there have been some suggestions as far as things like ozone therapy. Um,
That's injected, right?
yeah.
Or
Um,
okay.
how about infectious diseases? Have you gone through all of those?
You mean like send him to an infectious disease doctor? Or
Or do it yourself?
no, well, I mean we hepatitis, HIV, West Nile, Lyme, I mean like
Hmm.
what like we did all that. I mean,
You can
if you have a
probably do
specific
a Lyme panel and co-infection panel and mycoplasma. But I mean, no matter what you do, it is a very typical.
Right. What happened, Dr. Patel? You got cut off there. Um, mast cell activation, mycoplasm, or mycotoxin rather. Um, have,
oh, mycotoxin.
have you
Okay.
have you looked for mold and mycotoxins?
Like what do you mean? Like mold in his house? Mold like what do you
Yeah, you
I'm
can test.
sorry.
Well, you can test the house, or you can test him for mold, mycotoxin
Can
infection.
do the mycotoxin challenge test
Yeah.
where you take his baseline urine, or you can just put him in sauna and make him do the exercise and then give him the um, glutathione IV or oral, and then do the post exercise urine collection and send it for the mycotoxin levels. But usually, I have seen thousands of patients with mycotoxin, and usually, I mean, they do not have the all of the symptoms that this patient has. If there was cluster of symptoms, yes, but usually they do not have the fasciculation, and they do not have that constricting. But the part, if they have they always have a parts if it is a very severe poisoning, but they do not have the the symptoms that this patient was having. With the GI symptoms, yes, the GI symptoms they can have with the mycotoxin, but the neuromuscular symptoms, the extent that this patient is having cannot be just from mold or mycotoxin, even if the tests are positive. You have to look for
Okay.
another.
Yes. Okay. I have it listed and then I just put, like some of the things don't fit that, but I still have it listed.
Right.
And Dr. Sun mentioned some even spiritual issues and even some psychosomatic issues or sometimes he suggests you ask him about histories of encounters with occult practices.
Okay.
Um,
Okay.
Sometimes childhood traumas, come out as, like, a jumble of bizarre symptoms also.
Can we talk
Okay.
about this? You said he was on a soft diet. What type of soft foods is he eating, and what is the culture for his mother and his father? Where are they from, if you don't mind, or if you know?
Oh, like I don't know about his dad. I never met him, but his mom is Caucasian. She's I don't know. I don't.
Because
She
some
has no
people,
accent.
like if they're Norwegian, they might be more meat based than they are vegetarian based. And so,
Oh, I see.
yeah,
So
food
it's
is
weird
huge.
because sometimes he can eat some things and then sometimes he can't. Like his mom is super like like organic, like very she only feeds him stuff that she yeah, it's
She's probably
amazing. But
she's probably vegan vegetarian, if I have to guess. And
no,
if
he
and
was for a while there. He was doing the meat. Like they did bone broth diet. They've tried so many diets. They've tried bone broth diet. They've tried. He was doing just meat and eggs for a while because it felt better to him to just eat meat and eggs. And then that stopped. Like then every time he ate that, it would start giving him
Hi
pain.
there,
And
this is Becky Frank calling back again on a recorded line for the National Republican Congressional Committee.
No, that's not.
I was like, is she giving me advice?
Joel, we're getting hacked again.
I know we are.
Okay.
Don't even go there.
Okay, but yeah, it's weird because like one time like she'll feed him like almond butter with certain like like sprout sandwich or blah blah blah, and he's fine. And the next time it's like you eat that and it's like horrible pain, and
It's got to
it's
be
never the same thing.
it's got to be the mycotoxins or stealth infections. That's it just has to be because they're hard to find. Dr. Lewis and his group, they're pretty good at finding stealth infections. I don't know the test or the actual labs that he does or uses, but he's able to find a lot of these weird names, weird terms. And
Well,
Dr.
let
Clearfield
me
knows
throw
it.
out some. Let me throw out something, Mr. Joel. I want to I did Dr. Clearfield because I can't see it. Did anybody say anything about the copper level being low?
No, I didn't see that either. No, I didn't see
Okay.
anybody say
So
anything about it.
so here's the thing. When I mentioned that, I said when I give my presentation, I was like, I did not see those labs until today. Because that huge stack of stuff, it's like this 4 or 5 page thing. And then when you get to the very end, the copper was low. So he went back to the hematologist oncologist and she said, all your labs were normal. I have nothing I can offer you. But then when we were looking at that today, I was like, holy crap. If his copper's low, I never tested his ceruloplasmin and I never got a urine copper. He went through, so he could have Wilson's. He could be like depositing copper everywhere, which would explain his dad's death at like 40 of cirrhosis and his, when he went through that thing at the airport with like, and it lit up. I mean, I don't know if copper shows up on an airport security. I don't know enough about that, but
Or iron,
that was
or
weird.
excess iron. He could have had excess iron.
But the thing is, though, that his ferritin was okay. Like he had the first time they tested his iron, it was a little high, but then when they retested like a month later, it was completely normal. And his hemoglobin's never been high, and all the things. So I'm like, holy crap. So I was like, what if this guy is walking around with Wilson's disease? And like somebody tested it, like, which thank God they tested it, but in August of 2023, and no one's even like I haven't done anything about it until until literally today, as I'm putting this together and I'm entering the little boop, 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 and I'm like, copper low, what? And then you start, I was like, well, is Wilson's high or low? And then I was like, so it pops up, like serum low, urine high, ceruloplasmin low. And then just even the family history of this cirrhosis that in this 40s, I'm like, even if you're an alcoholic, I mean, we have alcoholics that have been drinking forever and they don't die till they're 60 or 70 of cirrhosis, And then the brother, what if he came back and had some sort of copper toxicity and he had neuropsychiatric stuff? I mean, yes, we blamed it on Afghanistan, but I don't know. I'm going off on a tangent and I'll stop. But at the same time, I was just sitting there going, what if he is?
Kelly, was she seen by an ophthalmologist or optometrist you mentioned?
He was. So he was seen at the very beginning of his symptoms and he had that weird, so they didn't say anything. I know where you're going with that. I was like, good job.
Yeah,
with
there's
the
a
iris
Kaiser
stuff.
pressure ring that you see when you talk about Wilson's disease.
You're right.
So
but
they
when I
can
was
see
reading
that.
about it, it said that early on it might not show up because it wasn't if it doesn't show up in the first 8 years, you might not actually have them until you're 40 or 50 and you've accumulated enough. So, I mean, you're absolutely right. And I could be totally woo, but I was sitting there going, "Maw, dang."
Well, one thing that I do encounter these cases, but me being a specialist in CIRS, I don't know if you're familiar with that term, chronic inflammatory response
Chronic
syndrome.
inflammatory response syndrome. Actually, I
Yes.
heard your talk and I printed a big article and it's at my office.
Okay.
You guys
That's good.
teach me all kinds of stuff.
Right. So this is something that I see as a slew of symptoms. And again, when I say biotoxin illness, I'm not only talking about mold illness. So everything that was mentioned here, Lyme, Ciguatera, Pfiesteria, and even I don't know if you heard of the Afghanistan syndrome that they were exposed to a lot of chemicals. All of these are biotoxins, meaning as the body receives these specific toxins, it creates this chronic smoldering inflammation. And one thing that I would suggest for you to test on him, it's a pretty easy test to do. It's called a visual contrast sensitivity test. And you can get this from survivingmold.com. This is not diagnostic at all, but it's actually going to lead you somewhere in relation to brain inflammation because when you have specifically, like for example, mold, it likes to go to the brain tissue, and this will show you that there will be brain inflammation through testing via the VCS, the optic nerve. And when that turns out positive, that kind of probably will lead you to a little bit of a more of a optional road for you to look into. But again, that's just a tip for me
Mario,
where to start from.
Dr. Nario, can
Yes.
I interrupt for a minute? The
Yeah,
visual
go ahead.
contact study can come positive in any toxin. So we just cannot say
Right.
that it is from mycotoxin and we lead the patient towards mycotoxin.
Oh, yes. So it's a non-specific test. It's just something that would actually open more options for her. I mean, she's exploring every conventional therapy here. I'm assuming this patient will go through the hoops. She's going to go see all these specialists, I'm sure. And that's what you probably need to do to rule out all of these pathologies that conventional medicine should rule out. And this will be a safer practice for you if you're going to get into integrative medicine afterwards and entertaining all of these integrative diagnoses.
So the visual, okay, so if the visual contrast sensitivity test is positive, it could even show copper accumulation.
That's not part of the criteria. I mean, one of the differentials when you go into a positive VCS test, it's really more of as part of what Dr. Patel mentioned. It could also be exposures to these noxious chemicals. So chemicals exposure could be part of that, but definitely um, uh, not specifically that. I can send you an article about this, and you
Okay.
can see what I guess the studies even about VCS and all the differentials that you can derive from it. But it just probably
Does
will
it
lead
show?
you to path.
Does it show like how to do it? or just Google that?
Oh no, it's very easy. What you're gonna do is just gonna close your eyes, and then it's a self-explanatory test, and the patient will look at a screen, and there will be grids and lines of different contrasts for them to look at, and it will produce a test result for you to see, and they will just send you a PDF result of that. So
Is
there's
that an
nothing
app?
involving you.
Is that an app? Or they
Oh no, you
just go
just go to
online?
survivingmold,
Oh,
survivingmold.com.
okay. Okay. Okay.
I'll
Got
type it
you.
in the chat.
Okay. Yeah, I can't see it for some. Can I minimize my thingamajigger now?
No, don't worry about it. I'll see, even
Okay.
send me, give us your email so we can send you more information about your case.
If you stop sharing your screen,
Okay.
and share, then okay.
Stop
There
sharing.
you go.
Boom. There you go.
There you go. Okay.
Am I back?
You're
There we
back.
go.
You're right up top here.
Cool. Yeah, so okay, here we go. KR Smith at ATSU.edu. So surviving mold, and then so it won't, yeah. So if it's negative, then it's not a toxin. If it's positive, then I have to look for what, right?
Highly unlikely. Well, that's when you now look. So majority of the positive VCS test turns out to be more of from water damaged buildings. So this is where the conversation of now mycotoxin, mold conversation comes into the picture. And of course, a small percent goes to Lyme's disease, Listeria, Ciguatera. But basically, yes, I agree with everybody in the room about mentioning about mold exposure, especially these places where he went to. And these are actually like Colorado, he said Maryland, the East Coast. And you have to remember that mold illness is not only present when you think that a person is living in a current residence. So that's not only where they are going to get that, even though when they get out of the exposure themselves, they carry that inflammation wherever they go. And that's where it becomes a little tricky. And even after the positive VCS test, you're going to be doing a slew of lab tests that will prove now for him to be diagnosed as truly CIRS.
Okay.
Dr. Smith, are you familiar with Dr. Daniel Amen? Dr. Daniel Amen. Dr. Daniel Amen, he's done SPECT imaging tests on brains, a couple 100,000 people.
You're talking about the Amen Clinic in Georgia.
They're all over the country, correct?
Oh, I didn't know that. I didn't know that.
Yeah, they're all over the country. He's done a couple 100 people, plus a lot of veterans, a lot of sports people. And what he's noticed is that cannabis is actually worse than alcohol. It actually blew him away. He just couldn't believe that. And so I'm wondering if your patient has used CBD to possibly negate, and Dr. Quinn might be able to chime in on this. There's different CBDs that can negate the effects of the cannabis that he's on. Because I know a lot of veterans are on cannabis, and it's very hard for them to get off. They can't sleep if they don't use it, blah, blah, blah. But if you start doing some CBDs, it can start to slow down some of the effects. And so he might not have as much fear. He might not have as much stress. He might not have as much anxiety. Do you know if he's doing any CBD at all?
He did do CBD. Actually, if you guys remember the cannabis talk, I can't remember the guy, but he was talking, and then he said, back pain actually is better with suppositories. Wow. So we whipped up some home CBD suppositories, and yeah, he tried them. I mean, this boy has tried everything. So yeah, we tried CBD. He does the THC, low THC oil now. I think he does have some CBD. But...
Okay. Yeah, as far as the CBD goes, if you're talking about suppositories, besides being a great way to administer that, one of the major benefits is if you want to use a higher THC content, if you use a suppository, you won't get as intoxicated as you would if you were to have smoked or even orally ingested it. So that's one way to go. As Joel says, there are so many different kinds of cultivars, whether, it really depends upon the ratio CBD to THC. And there's a lot of studying going on right now for exactly what you're talking about and what's happening with him. He's getting some pain relief, but it may be at the cost of some other issues that are coming up. So I wouldn't completely eliminate it, obviously, because he's getting some relief. But as Joel mentioned, I'd look for, I think they call it a type 3 that's got more CBD than THC. Type 1 is high THC, low CBD. Type 2 is equal. Type 3 is the other way around. You're going to want to look for that. That's for sure, if he's going to continue that type of thing.
Our
Thank you.
homeopathic friend in Austria writes that she would not recommend cannabis, which makes confusions worsens. It confuses other symptoms and worsens anxiety, reflux, and other drugs. And every patient's different. So just a suggestion there. Okay. So
yeah, no, I mean, honestly, they're in Georgia, so I don't think he's had a lot of cannabis per se. I mean, he has access to the THC oil, but now they're moving to Colorado. So I will pass on the recommendation of like, hey, this may not be the best without the CBD at least.
Okay. I'm going to send you, when we're done, I'm going to send you, and anybody else that wants it, I'm going to send you the chat because there's a lot of suggestions in here for homeopathic remedies. And again, some, it's kind of shotgun, but you can pick through them. And look some of them up. There's, again, homeopathic remedies are.
I'll have to.
Arsenicum is mentioned. Gelsenium is mentioned. Rafael Sanchez has a lot of suggestions here. He mentioned something about trauma. Again, was there a trauma or stress from the sporting school that he went to?
Again, like when you told me about the spiritual issue, I'll have to ask.
As soon as you mentioned Pennsylvania, I start shaking. That's where I'm from. So, transcranial magnetic stimulation again, and these are things to look at. Electromagnetic.
But he can't do that one because of the magnet.
Right. Okay.
Because he feels so bad.
Okay. So any of these brainwave magnetic stimulations, those are out, right?
Yeah, he feels awful.
Other than testosterone, the second one you showed was low, in my book. Other than testosterone.
Don't look at me.
No, did you do any, neurotransmitters or any of the other hormones? I don't.
What are you talking about neurotransmitters?
Serotonin, dopamine, all along those. Okay, so
progesterone.
There's sputum tests, there's urine tests that you can do, for those.
DHEA. We didn't see a whole lot of hormones.
We did the DHEA. We did that one. That one was normal. The only things that I regret really bad not doing are progesterone, estradiol, estrone, and pregnenolone.
Too bad Dr. Halas's not here. He'd have his whatever his latest combination du jour would be for mitochondrial formulation. So I think today's was a nose spray of progesterone and what was it? There was something else. Progesterone and somebody help me out here.
Started with a C.
Huh?
Methylene blue, maybe.
No, it started with a C. It was wasn't it yesterday's class or the class before?
Cyclodextrin.
Right, that's it. Yeah. Okay, so we're gonna give you all sorts of things you've never heard of, Kyle.
Hey, since I'm being noisy right now, and Melvin and Bill are here, and they are lead lecturers to next week's international symposium on homeopathy. Do either of you, after hearing all of these specific symptoms, have a step you would take with homeopathics, maybe even constitutional?
Well, personally, I would sit down with my materia medicas and go through each symptom and go through all of the remedies, just like the old homeopaths did 200 years ago. So it would probably take me a couple hours to get through that. So I don't really want to mention anything, as definitive. I don't know anybody else.
How
Teresa,
about Melvin?
yeah,
Melvin's also the expert. What do you think, Melvin?
Yeah, so you can think about the miasms in this case. So you're gonna think about the tuberculinum, syphilinum. But again, it
we're having a hard time hearing you.
takes a little bit more in-depth
Anybody
history
else not
taking
hear
when
that?
you. Oh,
It
I'm having bad
sounds
signal.
like
Is it
a
different history taking?
Marshall.
Yeah, he's breaking up real bad.
Melvin is a
Sorry, bad signal.
That's my excuse.
Martian. Okay. Hey, since we brought it up, yeah, I just but do you have a particular software program you use to throw all these symptoms in so you don't spend 200 years sitting at a desk?
There actually is Dr. Aaron Wolf down at our sister clinic. He has that whole process for homeopathic medicine, and he was trained in Greece, he was trained in Israel, he was trained in India, and it's just got all these parameters. And you click through each one. Da, 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 da. Are you hot? Are you cold? How do you sleep? What do you do? Da, 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 da. And everything she was talking about, it goes through the entire program, and then at the end, it recommends, the boron stuff, the little white pills, the homeopathic stuff, and it's pretty intense. That's what an actual homeopathic trained physician does. They've got that whole system in their computer. It's pretty big.
Yeah, except they didn't have computers when that all came about. So
I've been using those programs for 30, 40 years. You have one for a Mac and one for PCs. One best one
Right.
for PC is called Radar, and the one for Mac is called Mac Repertory. So we've been using it for at least 30 years. They're around, you just don't hear much about them, and it costs a couple of thousand to get it happening. But they work,
Right.
it's just throw it in. But even with that, you're like with this patient, how much time do you have? Who's going to do it? Who's going to really put those symptoms in? Takes hours,
Right.
3-4 hours.
Right. Hours. Yeah, I agree. That is frustrating.
yeah, a couple of other suggestions from Rafael Sanchez. A combination of sulforaphane, PEA, and luteolin, which are antioxidant, anti-inflammatories, for a mast cell type activation, IgG and lactoferrin for immune function, a high load of reishi mushrooms, ozone.
Yeah.
Those
Yeah, what you got? Yeah, I have that one down.
were his suggestions. Okay.
Yeah.
My experience with the VCS test is that if it's positive, it's a pretty good test. If it's negative, it doesn't tell you a whole lot. That's my experience with it. So,
Okay.
okay. And then again, our homeopathic friend in Austria mentions and how she found us was frequency specific microcurrent. So these are microcurrent devices that are used with specific frequencies for specific symptoms. You look up Carol McMakin. She's in Oregon, and she's got followers all over the country. There's probably somebody near you somewhere. That might be something else to take a look at. And what else? And again, from Teresa in Austria, metallic taste in the mouth, mercury possibilities. If the copper's low, the zinc is probably off also.
It
Okay.
was definitely on the low end.
Right. Okay. And so there's another whole rabbit hole for you to go down. That's
Right.
I don't know that we gave you
I'm
any
so
answers here.
appreciative, you guys. Yeah.
More questions than answers, that's for sure.
No, but you know what? Honestly, it's so helpful to like kind of come together and be like, okay, what did we not do? What could I do? You just feel so like can't do anything to help, you know? So this is, I mean, at least I have some, I could be like,
So
okay, we could do this, we could do
Dr.
this.
Patel's, really, the most knowledgeable person I've run across with environmental issues. So I would, reach out to her and see if she's got, what.
Dr. Smith, yeah, I will be available, and I think you have my phone number, right?
I don't know, but I'm sure that if Dr. Clearfield has it, he'll
I'll get it to her. Okay, I'll get it to her.
Yeah, call me if you're a dead end, okay?
Oh, thank you. I'll see now. I know I've reached this amazing level if I have Dr. Patel's phone number.
There you go. So you've made it. Okay.
Yeah.
One more suggestion.
Comments,
Yeah.
questions, suggestions? Go
Yeah.
ahead.
What happens if you rewatch this with the mother and the patient and let them see what is going on and see if something rings true with him a second time around? Because I went through a whole lot of sickness myself as a Marine, and sometimes you just forget stuff because you're sick. So if you went through this with the mother, they might ring in onto something and go, "Oh, hey, what that person just said is what's going on." I mean, it might be.
She actually was on there and made some comments. We decided together. She's on here, but we decided together that it would not be good for him to be on here because it would be emotionally charged, and we want to be able to have everyone ask all the things.
Okay, so
she's really good. Yeah, so she said we don't spray in the house.
Right.
And then she said that the birth father's birth mother said that all the males in their family died of early of neurological problems.
Wow.
So that's new information. I mean, I didn't know that until she just typed it in there. So again, like this Wilson's thing, I will let you guys know. I'm sure that I don't know what they're going to be willing to do, but I'm sure like we'll probably get this RBC acetylcholinesterase level. And then we'll go down the mycotoxin rabbit hole, I'm sure, but I need to learn more about it and stuff.
Mm-hmm. Okay.
But I so appreciate everybody's. I mean, I have everything written. I'm taking it seriously. I very much appreciate it.
Could you take another question?
Sure, go ahead.
Of course.
Oh, okay. Now my microphone's working. I was doing a scan and wasn't working. Well, I'm not a practitioner. However, I was a psychology major at Georgia State College, so you won't hold that against me. Right?
I won't hold it against you, no.
Okay, good. So anyway, I was thinking about kinesiology for picking a remedy that might help. Like, muscle testing, O-ring testing, whatever. But what I was curious, from a personality foundation, did the guy have let's say a good church going upbringing with his parents? Was he a good old boy, or was he conservative? And also, who did he love or who loved him? Did he have any heartbreak? And, did he have psychologically a functional upbringing? And, that could tip off depression too if things aren't going well. And you can't be a mind reader in the time you have to see somebody.
No, you're absolutely right. I mean, and I will ask that.
And maybe meditation would be good too. Like some yoga or meditation or mindfulness, that might be helpful.
He was involved with yoga. Like he was doing that, and then he got so exhausted, like even just moving would just like wear him the mess out.
Was he doing meditation?
Yoga.
Was he doing pranayama, kundalini, like the more active, wild things? I mean, there's different flavors, there's.
You're right. But
They-
at the same time, I just sit there and I go, there's some of these things that, like, I don't know if true. I mean, because obviously I'm an osteopath. So body, mind, spirit. It can't just be
Right.
one thing. Right. Okay. So
Right.
with that caveat thing, I'm just saying there's so many of these physical symptoms that he's having. Like, the psychological stuff wouldn't set off the, going through the airport security and that wouldn't
Yeah,
cause the low copper, the diarrhea.
but I also want to say you're very caring and you're compassionate and you care about your patients, and that goes a long way.
Thank you. Thank you. And also, like, the crypto. How in the world did he get crypto? And keep it for a while, it's just, there's so many little things that are just like, wow. It would be so easy for me to say, like, I'm going to send you to the psychiatrist or whatever, which I agree. I mean, always there's something there, with your mind and with your spirit.
That's why research is so exciting. There's always new frontiers.
Yeah. So I agree. I mean, we've got to do it in all those realms, but I still haven't like settled.
Does he have
the
any EMF or EMR exposure from cell phones or, radio devices?
I mean, he's had it.
Smart meters, that kind of thing too.
I don't know. It's a question I can ask.
They'd have to go look outside, and there's I can't remember, it's a 5G website that'll tell you where your 5G towers are by your area.
Oh, antennasearch.com.
Oh, exactly.
Antennasearch.com.
Mm-hmm.
Yeah, and if he's super sensitive, then it would definitely cause all this. That's for sure.
I think we're in a toxic soup some days.
Yeah.
Great.
Yeah.
I have a quick question here, if I can throw this in. Along the lines of what Dr. Patel said, I mean, I'm looking at, I see the world through toxic glasses. Everything is toxicity to me. And when you did, you mentioned the results of heavy metal testing, and it was done twice, and it seemed to be negative. Was that, and the metals that you mentioned are just routine things that they can find in blood? Do you know if it was a provocation test, a urine provocation test?
No, it's not. It's just a random. It was just a random test.
Yeah, that's weird because that we kind of all look like that for the most part. Like, there's not much there. But boy, when you do that urine provocation test, it will pull the metals out of the cells because the metals are sequestered in the cells. Lead is in bone. I mean, and it can be there, and we just don't see it unless we try to pull it out.
Are you talking about the one with the exercise, sauna, glutathione, and then
No. It's a 24-hour urine provocation test for heavy metals. I don't know if I can mention, it's Doctor's Data does it, but I don't know if we can.
Well, you just did, so it doesn't matter.
I don't know if we're recording, but
I know Stefan's.
You have no affiliation with him, correct?
Correct. Not at all.
All right, now we're good.
But Stefan's lecture with iodine, I know he said, that a bunch of stuff, once you start giving the iodine, it'll come out. Do you know what they provoke that with?
Yeah, well, there's different ways. Generally, you would do the provocation. Okay, so what happens is the patient kind of pees in a cup, and then they take a baseline measure of the metals there. Then you do a provocating agent, which is either EDTA or DMSA, which can be done orally. EDTA works best IV. Then they collect the urine for 6 hours and retest the metals. And that gives you body burden of how much metals you really have in your body. And it can cloud everything. I mean, when we're talking about the EMFs and all of these things that are happening in the world, like you said, Shell said, a toxic soup, we have the EMFs and all that, and they activate the heavy metals, which causes tissue damage. If you don't know they're there, then you just completely steer away from it. And that is a simple test. It's not expensive, that can be done. And it's just nice to eliminate that, because with this guy's exposures, there could be mold and all these other things, I think that's kind of start to eliminate the exposures and what you can do about those. The glutathione and the alpha lipoic acid drips and all of these things can help with all these chemicals.
Okay, so do the provocation test for the metals, and then do the mycotoxin one with the glutathione, sauna, exercise, and then do the urine after that.
Yeah, makes sense. Yeah, definitely.
Okay.
So
Okay. Cool. Thank you.
We have someone with their hand raised, Doc.
Yes.
Joan.
Dr. San Juan.
Yeah, hi. Hi, good morning. I've had one case, probably that was 6 years ago, who came in because of severe fatigue. She is a mother. She cannot, all she can do is lie down the whole day. She cannot take care of his son, do the house, do the regular things that he has been doing. Now, financially, she's exhausted because she has gone through a lot of workups the conventional way. I came across this limbic retraining by Anna Hopper, and I asked her to buy the app online. It's the course that she has to take. Aside from doing the usual integrative modalities, we added the limbic retraining. In the limbic retraining, since the patient has gone through a lot of trauma from childhood, the neurons the communication inside the brain is locked. So that whatever modality you do will seem useless. So she finished the course, and together with diet modification, nutritional supplementation, and I also did some intravenous vitamin drip. After a few months, she's back to normal. I hope you can pick up something from there. Now,
that's wonderful.
Yeah. According to doctors like Kelly McCann and Dr. Gail Clayton of the molddetox.com, if you encounter a difficult patient with multiple chemical sensitivities, try getting hold of the brain by doing the limbic retraining.
So chemical
I hope that helps.
No, anything helps. Thank you so much. Appreciate it.
Yeah, you're welcome.
Thank you.
Thank you. Again, there's magnetic resonance devices, a mag Healy, but there was some issue with the magnets with this patient, right?
Correct. Yeah, like can't do that.
No, I think what she's saying is that's for the water. That's how you get your water to go into fourth phase.
Okay. And let's see. Okay. So Dr. Sanchez sent you over some recommendations, including molybdenum and zeolite. I guess those are binders, right? And
binders, yeah, zeolite, I know.
Trace
but
metals and glutathione. Even
okay.
glutathione. I can get you the brands off camera if you need it. Okay. Okay.
Hey Doc, I think what she was trying to say was the mag Healy turns the water into fourth phase water. Mm-hmm. There's devices that can supercharge your water, and it super hydrates the body compared to regular water. And Dr. Veda Austin, I don't know if she's a doctor, but Veda Austin is one of the people that made this popular by using Petri dishes. She would sit the Petri dish on top of a picture, and the water would actually have memory and would copy the picture, and she would freeze it. It's crazy. So when you take care of your water, and it's life-changing. So I believe that's what you were mentioning, Teresa, correct?
Yeah, you're muted, Teresa.
Yeah, I know. What's the question? Sorry, Dr. Peterson, what question? About the water?
I'm actually not a doctor. I actually am a certified coach. But the Mag Healy, what does that do to water?
The magnet frequency just set the where's mine? But it's it's on it's my son. I'm using it actually on my son is epileptic. You just put it looks like a smoke detector. You just put it like on top of the bottle and it just resonate. It just goes for 10 minutes and I use a little Healy. I use a little this little Healy to tap into the information field and see which remedies it would recommend for the Mag Healy for the water programs, and then I just would, if it says energy or circulation or whatever's indicated by the quantum, then I just put on the bottle of water the device Mag Healy and make the water magnetize, or put on my son, for example, epileptic, or now it's coming out, he has post-traumatic stress and not even seizures after they tried all the drugs, that the trauma was the underlying reason with the vagus nerve, that is the autistic regression. And so that's what I speak about, this cannabis experience and things. Yeah. So anyway, I'm a little tired at 4 a.m, but the Mag Healy came out just a few years ago and can be for the water, and then for Carol McMacken has the brain harmony, vagus harmony, because with the vagus harmony you don't get autoimmune conditions, the harmony of the vagus nerve. And so it's better something like that than like Facebook show. So many people are just being proposed to buy these things just balance your vagus nerve and everything's solved, all the trauma and everything. But the vagus nerve can only be turned on for 1 to 2 hours at a time with these kind of devices. But at least it gives the immune system like a break. And then this frequency specific microcurrent. This Carol McMacken will treat my son in a Congress coming up in Poland, because I'm in Europe. So anyway, it's been helpful to me. I've used the quantum devices for a couple of years, and I learned homeopathic medicine. But when you take chemical drugs, it's all confused. You can't just take a specific homeopathic medicine like mercury, solar, or whatever, when you're taking allopathic drugs, because everything is totally suppressed or palliated or aggravated or confused. The symptoms are all like shifted around like that. It has to be that the allopathic drugs has to be lowered maybe, and look at the trauma issues to calm down the brains of the patient, of at least in my case, because I had the top neurologist from the world, practically, Professor Baumgartner. When all the drugs, it's such a shame for the poor patient to have to go through all of that with all these stupid drugs. And I mean, and reactions, everything, to finally say, oh, after all these years, there was a trauma underneath the whole thing. Why they can't identify what the person's adopted and doing and very creative music and loving parents and push-ups and physical fitness. It must be so frustrating to the or if I wondered if the liver issue has anything with anger or any kind of things behind that with the liver. I mean, like another thing like frequency could address increasing vitality and secretions in the liver or something, which, I mean, whatever would turn the immune system back on. But it sounds like she is so wonderful family and patient to be, and doctor, I mean, to that the healing process should be right on track. Okay, so thanks.
I hope so.
So
Thank you.
So our trusted AI companion actually gave us a little summary of what we got here tonight. So
Nice.
visual contrast sensitivity testing, consider neurotransmitters
Okay.
and extensive hormonal testing, contact Dr. Patel for environmental exposure. Peace,
Yeah.
look into EMF, EMR exposure history,
Yeah.
and perform heavy metal provocation testing and myco testing with a glutathione challenge.
Yeah.
So there's your marching
Go
orders.
AI. There have got to be some good things, right?
There's your marching orders.
Yeah, that's
Okay.
great. Thank you.
All right. So you did great. You know, you were so nervous. I think you did great. And it was we appreciate this. I mean, this is obviously a difficult case, and there's not going to be an easy answer. Hopefully, there will be some answers somewhere along the line.
Yes.
And so, Teresa, I don't know if you see in the chat there, Rafael Sanchez recommends a Magdalena Kubala. I can't pronounce the last name, an MD, somebody in Poland there. So there's a name for you anyway. Okay, anybody else have any comments or questions? Everybody's heads exploding now with the 9 million things we went over and no real resolution, but at least there's sort of a little hierarchy there of
there's a path though. That's the thing. Like I was at a brick wall, so
at
least there's a little path.
I every once in about almost every week somebody asks for the transcript from that we record, and so far I haven't been able to get it out of the system that we have. So it's not that I'm ignoring you. It's just like I've been trying and I can't seem to get it. So not sure why. Okay. So we'll but we do have the chat. I can actually can I put the chat on our website? Is that, or in the comments on YouTube? Do you think that would be an issue? Probably with YouTube. I can put it on our website. So
all we got to do is ask Chat GPT what we got to do. Yeah. Right?
Yeah. Okay. Yeah. That's the new boss. Okay.
Amen.
Anybody else have any comments or questions? So we could. You did great, Kylie, and it's always hard as the first time. Next time it'll be a little bit easier. So next week, we're gonna have one of our newfound friends from the Philippines speak for us. It's going to be Eric Van Watson, and he's going to be talking about C15 or the fatty 15. So it's
Dr. Bill, can you hear me?
Yes, go ahead.
Oh no, this is the US. So
oh, he's in the US. Okay. All right.
Yeah.
We're going to hear about the fatty.
Do you want me to do some introductions here?
Yeah, go ahead.
Okay, so this is a C15 company, and this is one of the more sought out supplement companies recently in the market. It's called pentadecanoic acid. So I highly suggest everybody see this webinar, and this is going to be presented by Stephanie Van Watson, Dr. Stephanie Van Watson. And they actually had a journal coming out on metabolites, a 2024 published paper. And this is something that proves their product to actually prevent or even lower down ferroptosis and prevent cell death, thus reversing aging process in the system. And one of the highlights of this would be after 90 years, this is again another new essential fatty acid that's been discovered. The last one was the omega essential fatty acid. So something that they wanted me to highlight for their talk. And next week, this is going to be a big one for our group. So just wait for it, and we'll be sending you guys the link.
Okay, that sounds great. And you want to tell us again, your involvement on Friday and Saturday with the homeopathic summit coming up?
Yeah, so you and me will be presenting our bits for the Bioquantum Academy. And my focus would be more on acute homeopathy and clinical practice. So this is basically actually my own story and my journey on how I started with homeopathy, and maybe also a good starter program for clinicians who wants to jump in there. Because I know we've been talking, Dr. Burgess mentioned about constitutional therapy. All these are very complicated ways on how to get into homeopathy, but I'll probably start with the basics and also tell you my story, how I got in there. So join us on Friday and Saturday, and we gave free links as Dr. Parvin being gracious to our group and to the Prima group. So please feel free to join us for this event. And as you heard from Dr. Bill, it's all international cast for everybody to learn from.
Okay. And do you have the link again? I know you put it in here. I'm trying to find it.
Yeah, that's at the beginning, like really start of the chat.
Yeah, okay, here it is. Here it is again. Okay. And it begins 9:15 a.m. Friday morning. That's Eastern time. So it's 6:15 on the West Coast. And Teresa, you're gonna have to figure out what time that is in Austria. I don't know.
Yeah, it's a paid event.
4 in the morning, though.
No, It's that the brain is way too tired, and 9 hours at times. It's a crazy day is night and night is day.
Yeah.
So yeah, we
would
were
be
given
3 and
this
6.
as
It'll be 6 p.m. for you.
this is a paid event, Dr. Bill.
I'm up day and night with an epileptic. I'm up. It doesn't matter.
I talked to Dr. Zarin today, and she says our group is it's complementary to our group. Okay, so that's what she told me. So
that's pretty great.
Okay. Okay. So next week again, we're gonna learn about some new fatty acids. Kylie, that was a terrific presentation, and you're gonna come back periodically and give us updates on your patient here.
Update on the patient. I will. Absolutely.
You're gonna find out within 2 years' time that we'll have solved the mystery. Okay.
Oh my gosh, that would be so dope.
Okay. So and thank you,
Dr. Bill. Dr. Bill.
Yeah.
So just a shout out for the Philippines here. We are starting to get ready for one of the bigger events in the Philippines called the Healing Revolution. So it starts on August 14 to 16, I think. Correct me if I'm wrong, from the Philippine group. And this is going to be almost like the A4M convention, as big as that for integrated practitioners in Manila. So it's going to be happening in the SMX Convention Center, and hopefully, I think, they're going to be. So one of them will probably promote this as well. But let me just start the ball rolling for them, because this is one of the bigger events of integrative medicine in terms of education.
Find out if there's a virtual component to it, so those of us that can't travel to the Philippines can maybe participate.
Put it in the chat. Yeah. Exactly. If you could put it in the chat, that would be awesome.
So,
I'm going to be asking them about it, and I'm going to be one of their speakers too. Yeah. So I'm going to be traveling and joining them and sharing the good news that we have over here for them to actually experience it and even apply in the Philippines.
Okay, great. Okay, I want to thank our folks who are new. You're welcome here. We're here every week, 5 p.m. Pacific, Tuesday nights, 8 p.m. Eastern. If you have something you'd like to present, please let me know. Because we have endless Tuesdays. We come up with we try to come up with interesting topics and interesting speakers. And Dr. Smith, you were a superstar. So
I'm telling you what, I appreciate you letting me do this, because now I have this huge weight lifted off my shoulders of like I've done everything.
Now you've done one. Look out, right? Look out, world. So.
Oh yeah, no, just putting it out into the universe. Like somebody's gonna come up with something for him. It's gonna be worth it.
Okay. All right, thank you. And Mallory, I after the initial shock of our guys showing up without shirts, I hope that Okay, you weren't too red in the face there, so.
Poor
No,
Mallory.
it did.
It's 120 here. It's 120.
Special thank you to Teresa, being up in the middle of the night, being with us. I know it's not easy, we start what, at 5, it's 2:30 in the morning when we start your time?
I just nap a couple hours and yeah, a cat nap, and then wake up and make myself a cup of coffee and have to get redressed out of pajamas and makeup and whatever.
Oh, you don't know,
I
Look
mean,
at the way these guys, look at the way these guys are dressed. So
yeah. I mean,
We don't need to
that's why
read.
everybody doesn't have their face on there because it's like,
right. You're fine just the way you are. Thank you for being with us, and thank you for all your suggestions and your help, by the way. Okay. Anybody else? John, what do you got? What do you hear from the medical school?
Everything's 100% good and getting better, so we need to have a talk.
Okay.
And having all the support from the Philippines and Europe right now puts us in another very positive position. The people who trained me 40 years ago were from Europe and from Asia. And now we have representatives from both areas who understand that stuff. We're with our group, so it's kind of super wonderful.
Yeah, we want to thank Melvin for bringing the Filipino contingent along, and we're glad to have you. And Teresa, if you have any contacts, if you have any that would be interested in our I know it's in the middle of the night. We do have a website. We put all the videos on there, so you don't have to stay up. You don't get the interaction, of course, but we do have it. So.
what are you looking for? What do you need in Europe?
Every week I always end with bring one friend with you, so we double our senses.
Okay, I say the Professor Dr. Michael Frost, who's my son's godfather, and started the journey with homeopathic medicine back in 28 with the last 14, 15 years with my 23-year-old. So an interesting president, maybe still from Holistic Medicine Austria, Michael Frost, Frass.
Okay.
He's had the homeopathic ambulance for cancer in Vienna General and is now retired. But he's still making a lot of interesting, he speaks English and making a lot of interesting videos and might be willing to be, I think for sure he'll want to be a guest on your show.
Okay.
We're looking to back each other up is what we're doing to take on this whole big pharma complex worldwide. So like Dr. Burgess said, the more we could institute internationally, then the better this is going to be for all of us.
Yeah. Well, we do, I mean, Europe has everything homeopathic, 60% of population are using it. It's not, I mean, America, in Cleveland, where I'm from, the library is devoid of materials. They don't even know arsenicum album or anything. And the remedies they can get at the health stores or the pharmacists don't. They sell these restless leg and these Boiron complex things for sleep or whatever. And that was maybe my first exposure in America at a drugstore. But it's really kind of crazy if a person has I don't know, whatever problems or nursing home or whatever situations, and all of a sudden could give them a restless leg complex from a drugstore and said, wow, thanks a lot. Or I gave a Marine veteran so on Ignatia remedy, said, wow, that is Special Forces Marines, a trauma, and at the breakfast table of mom's retirement home, oh, here's some Ignatia globules, hey, that really helped me, and like in Europe, it's so like everyday knowledge of those things. And in America, in the library is like almost nothing. And the Cleveland had homeopathic hospitals, and things were just like wiped out, like erased. That the Flexner report, Rockefeller remains, except people said somehow maybe they come across a little bottles of remedies, but in America it costs so much money for the pharmacy that the people, even as Dr. Zaran said in Canada, that she has to order her things from wherever because the America, they're not made. They're just got these little Boiron mixtures and things, that they sell it at the Walmart or stores, but the people are not real familiar, savvy with that stuff, or whether I don't know how popular it is over there, but I mean, here it's more the pharmacy, they are educated and they can help you for free of charge and, sell you something at the, here. So, okay, I hope it's interesting. That's fine. Yeah.
More
I
likely
do want to say,
go into a
I want
pharmacy
to
here,
say
they'll
one
tell
thing.
you, oh, that stuff doesn't do anything, right? That's what you get in a pharmacy here.
And they
So
say the
Right.
same in the hospitals. They don't cooperate, even when they have a homeopathic clinic to pay to treat the neurologist in the same hospital with the homeopathic doctor. Then they don't want to know about each other's existence. It's all being shut down in Vienna General. They're no interest in that. They shut down the homeopathic ambulance for cancer. They shut down the children's ambulance. It's really a problem. But can't take on the whole world and I felt like Mother Teresa of, I mean, the problem, the people can't afford that kind of advice, or they just get all these compounded, complex remedies and it goofs the whole, I mean, it might cause more confusion to start getting alternative medicine when there's already so many allopathic drugs running in the background, it could temporarily help, but in the long run, I don't know. It could confuse things until they try to get off some of the allopathic drugs. It's just my experience.
Okay. So, and just one final note, John, you'll find this amusing. So I received a letter from OPAC, which is the Osteopathic Political Action Committee, telling me that in 2 weeks is the House of Delegates meeting, and how come the American Osteopathic Society of Rheumatic Diseases are the only subspecialty that's not 100% made a contribution to OPAC. So, so those of you know that 2 years ago we were decertified because we strayed from our mission, allegedly. So, so they basically we were banned, we were canceled, and
we didn't stray from our mission. We strayed from their mission.
Their mission.
That was different, and they didn't like that.
Yeah, they didn't like that.
100%.
So I wrote them back and I said, I don't think we're going to be making a contribution. So so was that wrong?
No. That was
No,
completely
no,
right.
but we should talk about this whole situation. Do we reinstate with the osteopathic profession? And the other thing is, do we go international? And I think we might want to do
I
both.
think I'm liking dealing with the international folks better, right?
Yeah.
Yeah.
Well, we have a whole separate international thing going on that's not Dr. Zarin. She's doing the homeopathics. But what you and these other guys are doing, and the guys in the Philippines,
I'm actually
unlimited.
I'm liking
Yeah, but it's
Filipino
unlimited medical surgical with some of these guys. So we should put something together. And we're in the process of doing that. So we'll talk more.
Okay. And since AOSORM got decertified, technically, let's just be honest, they're done. So we need to go back into AOSIM and do that one and restart up. Just saying. I think that'd be the best way.
Well, now you got the Nevada Homeopathic Board along with this mission. So, yeah, we're getting stronger on this.
Yeah, that changes everything. Thank you, Melvin.
Yeah. Okay. All right, everybody. I know it's late on the East Coast and it's really late in Austria. So it's almost morning. So thank you so much for being with us, everybody.
Yeah.
Dr. Quinn, thank you. If you got any last words, any of the is it Prima? Is that it? The Melvin?
Yes, that's correct.
And any of the Prima folks, if you have any comments or questions, and next week, like I said, we're going to be learning about a new fatty acid. And we'll learn what to do with it. So thank you so much, everybody. I'll have the videos up as soon as I have them ready, and we'll take it from there. Okay. So good night, and have a great night. Rest of the night, if it's early where you are, and if not, Miss Teresa in Austria, get some sleep. Okay. Thank you, Kylie. It was fabulous. You did great. So. We're gonna have to have you come back and do it again. That's how, so you don't get off the hook now. Okay?
All right.
So,
Thank
all right,
you.
everybody. Good night.
Bye.
And thank you, Mallory, too, for being here.
Mhm.